what is the reason for the young teenage male, or more often female, to pass out? We find the patient generally is either sat down and passes out, or out shopping when all of a sudden she may feel faint and collapse. Now, generally this is, as I say, more females than males who are affected, and so from here on I'll refer to it as a female patient. Say around 14 years of age, average. And what happens is we find they have a sudden reduction in the level of consciousness, and then they pass out. The question is, why have they passed out? And there are a multitude of factors here. This is not definitive, but perhaps the most likely reason in most circumstances. So to understand the reason, we need to appreciate the physiology here and the circumstances in which these episodes occur. More often than not, the setting is such that the patient is in a room that is poorly ventilated or overcrowded with the poor ventilation, and or otherwise they're in a shopping centre, a shop in the midst of the hall or the shopping mall, again which is poorly ventilated, overcrowded, and or in all circumstances, be it a room or the shopping mall, very, very warm. So what happens? Well, let's understand a little bit about the physiology here. Normal physiology is such that when we are warm, the body wants to lose the heat so as to lower the temperature and not overheat. Standard thermal regulation as per homeostasis. One of the mechanisms by which this happens is by what we call peripheral vasodilation. So the blood vessels that sit very much in the superficial area of the body, i.e. just under the surface of the skin, these guys vasodilate, they open up. And the reason they open wider, they actually dilate, they widen, so as to allow a greater amount of blood to flow through. And the greater amount of blood flowing through the surface of the body allows for greater amount of heat to be lost to the surroundings. Like I say, this is normal physiological response, normal thermal regulation, homeostatic mechanism to lower that temperature. Now, because volume and resistance, or volume and pressure, are inversely proportional, as I increase the volume because of the vasodilation, the pressure of the blood actually drops. And so what therefore happens is we have a reduction in what we call peripheral vascular resistance, i.e. the resistance that was being created by the superficial blood vessels in the extremities, for the most part, has reduced, and therefore the blood pressure ultimately drops. As the blood pressure drops, that then causes a slight reduction in the blood actually reaching the brain in the same way as it should otherwise, and that transient reduction causes the body to switch off. It's a reset button essentially. It's like the safety trip. The reason for that is then the body will collapse, the patient will collapse. As they collapse, the head and the brain will essentially become in line with the actual heart. The blood will then actually continue and be able to travel to the brain to allow the perfusion. So in short, this is a transient episode of hypoperfusion to the brain, and a very transient element of what may develop into hypoxia. And that then causes everything to switch off and the trigger. As I say, why is this the most common reason? Well, partly because most 14-year-olds do not hydrate adequately. They certainly don't hydrate, again, generally speaking, in the warmer weather or the warmer climate or environment, that is. And a lot of them don't actually have very good eating habits. And so this may well be coupled with an element of hypoglycemia and or otherwise reduced blood sugar levels. And I'm not saying this is a hypoglycemic attack, but what I'm saying is perhaps this may be coupled with that because of poor eating habits. The other thing this may well be coupled with in this age group also is the fact that at that age, the individual is going through menarche and things are stabilizing. Menarche being the onset of your cycles, your monthly cycles, your menses. And so what starts to happen is we start to cause voluminous loss of blood. And appreciate that the most common cause of iron deficiency anemia in a female of childbearing age is menorrhagia, which is heavy cycles. And again, I'm not suggesting that they are heavy cycles, rather what I'm suggesting is that the blood losses that occur are actually new to the body, and the body is trying to adapt to these as it moves forward. Physiological adaptation can take time, particularly in these kind of things and situations. So that's again another factor that comes into play that we need to appreciate and consider when making a diagnosis to understand the reason for such episodes. In the absence of any definitive finding, such as menorrhagia or iron deficiency and or reduced blood sugar levels, this is what we then would refer to as a vasovagal syncope. Otherwise, sometimes what we can say is these vasovagal syncopal episodes may be situational, hence sometimes also diagnosed as situational syncope. So there you have it, the reason why your young female who may not be adequately hydrating, adequately eating, is perhaps in the changes for the menarche and menstruation. And also consider the level of salt intake perhaps is a little bit on the lower side, purely again due to the poor eating habits and the impact this has on every day and the concern that then leaves parents with. Thank you for watching.